Hi, my name is Chad Watkins, and today I wanted to talk about fungal nails or onychomycosis. Fungal nails or onychomycosis is a very common condition that people will deal and suffer with. It often is that the nail will become thick, yellow, brittle, crumbly, and often can give people pain or discomfort. Now, as we get older, often we'll be susceptible to getting a fungal nail or a fungal infection of the nails because of the circulation. So because the foot is so far out from the heart, it's harder to get rid of. That's why when we're treating it with oral medications, when we do fingernail treatment, it'll be a 2-month treatment of the oral medicines, whereas when we treat the toenails, it'll be 3 months because it's much harder to get rid of the fungus in the toenail. So some of the simple over-the-counter home remedies are tea tree oil, Vicks Vapo Rub, and white vinegar soaps, but they don't usually work. There are topical medicines that we can do. There's a medicine called Penlac, which is usually like $80 a bottle, and you'll paint it on like nail polish and remove it once a week with nail polish remover acetone. Now you have to do that usually for 3 to 6 months, and it only works about 40% of the time. There are other oral there's other topical medications like Jublia, which can be like $300 a bottle. And you don't have to paint it on, you just drip it on the nail, and it works about 50% of the time. So you get about 10% more relief. But there's a very common oral medication now, which is generic, called Lamisil, that you take basically 1 pill a day for 90 days. And it's $4 at Walmart or Winn-Dixie. What you look at, the problem with Lamisil though, is we have to check the liver in order to make sure that the liver is functioning okay. But I tell people alcohol, Tylenol, cholesterol medicines are usually more damaging to the liver than Lamisil, but we can't say that the Lamisil couldn't hurt the liver. So what we do is we check the liver at the beginning to make sure that it's okay. Then I check the liver in the middle in order to make sure that there's been no damage. If we see any type of change, then we stop the medicine so that the liver can heal itself, because the liver has regenerative powers. So usually the simplest and easiest and most effective way of getting rid of the fungus is to take Lamisil, which is an oral medicine. It's less costly, it's more effective, and it's easier to do because it's a pill. But sometimes people will want to do the topicals, and I don't mind people trying topical medications, but the topicals work on mild to moderate cases, and they only work 40 to 50% of the time. Now you can try all the home remedies, but they usually won't work. I have yet to have any patient be able to use them, come back in, and show me complete clearing of the nail. Now sometimes they'll see improvement, but they won't see complete clearing. So if you have problems with fungal nails, give us a call at Watkins Foot and Ankle Clinic, 352-805-4317.